Hello and welcome to this video presentation about social anxiety. My name is Livia Chan and I'm here to help you understand what social anxiety is, how common it is, and what you can do to cope with it. Social anxiety is a term that describes the fear of being judged and scrutinized by others in social situations. Another common term that usually means the same thing is shyness. It can affect many aspects of your life, such as having conversations, introducing yourself to someone you like, attending social events, giving presentations, interacting with retail clerks, using public washrooms, making phone calls, or eating in public. You may experience physical symptoms of anxiety, such as sweating, shaking, blushing, or feeling nauseated. You may also want to avoid or escape from the situation that makes you feel anxious. If you have social anxiety or shyness, you're not alone. Social anxiety is very common, affecting up to 10% of the population. It often starts in childhood. Some experts consider social anxiety to be a medical disorder, while others prefer to look at social anxiety as a style of being which deserves empathy and acceptance from others, rather than only a pressure to change or treat the symptoms. People who have social anxiety often contribute in positive ways to groups because they are gentle, polite, sensitive, and thoughtful. But for severe social anxiety, which is interfering with a happy life, the good news is that there are effective treatments. One of the most widely used and researched treatments is cognitive behavioral therapy, or CBT. CBT is a type of psychotherapy that helps you identify and challenge the negative thoughts and beliefs that trigger your anxiety. It also helps you learn and practice new skills and behaviors that can reduce your anxiety and improve your confidence. CBT can be done individually or in a group. Group therapy can be especially helpful for people with social anxiety because it gives you a chance to practice your social skills with others who understand what you're going through. You can also receive feedback and support from your peers and therapists. Many studies have shown that group CBT can effectively reduce social anxiety. Another treatment option for social anxiety is medication, such as antidepressants. Antidepressants can help reduce the intensity of your anxiety symptoms, but they also have some side effects and may not work for everyone. If you decide to take medication, you should consult with your doctor and follow the instructions carefully. Now, let's look at some therapy ideas to manage social anxiety. Here's an example that has happened to my friend Mary. The trigger for anxiety was doing a public presentation. Mary thought that the people in the audience were judging her negatively. As a result, she felt scared and embarrassed. She was shaking and sweating. She rated her anxiety level as 8 out of 10, with 10 being very anxious. Here are some of her thoughts at that moment. I don't know what to say. I look stupid. Others are judging me and scrutinizing me. Other people think that I'm doing and saying something dumb. What are some of the ways to cope with those thoughts? Mary can say to herself, I could take a deep breath and meditate. I could remind myself that I have no idea what everybody is thinking about. I'm not a mind reader. I could remind myself that everybody makes mistakes and it will pass. Next, Mary could imagine how she might feel differently if she changed her thoughts. Mary can say to herself, I could probably manage to have an open posture, smile, and make eye contact, even when I feel nervous. I may feel less anxious. Maybe I would have an anxiety level of 5 instead of 8. Let's try another example. What are some of the thoughts that go through your mind when you are in a social situation? You might think, people don't like me, or people are mocking me. Let's learn how to respond to these thoughts. What are some of the rational, positive responses to your thoughts? You can say to yourself, it's because of my anxiety that I think people don't like me. In fact, people are simply listening to me. Imagine how would you feel and act differently if you modified your thoughts in a social situation. You would be able to be more social with your classmates or coworkers. Just like with exercise in the gym, we get a little bit stronger as long as we keep practicing. So those sweaty palms and racing heart are signs of your mind and body training hard to master your anxiety. When you notice the shaky hands, the sweaty palms, the racing heart, maybe a little bit of dizziness or nausea, remind yourself that it's a sign of your mind and your body getting stronger as you work on your anxiety. One thing that many shy people do when they notice the racing heart is to go back into their turtle shells because they think that they need a break. But I want to encourage you to interpret the racing heart as a healthy thing instead, and that it's safe to stay outside the shell a little bit longer. So to summarize, how can you get started on CBT for social anxiety? A first step is to make a detailed list of all of your symptoms, such as all the situations where you feel anxious and how severe your anxiety is. The next step is to learn about social anxiety, to understand that the negative feelings you get in social situations are not dangerous and are just symptoms that will diminish over time as you work on your anxiety. Then look at your anxious thoughts. Work on ways to respond to these thoughts in a healthy way. The next step, just like all of our other discussions about anxiety, is to practice skills and to practice exposure to anxiety-provoking situations a little bit at a time. For example, you can have exercises to practice, such as interacting with a cashier at a coffee shop, saying hello to a classmate you have never spoken to before, or making a short speech in public. There are groups such as Toastmasters where you can practice. As with all other exercises to master anxiety, you have to start with easy assignments, repeat frequently, and increase the difficulty when you are ready. And just like any exercise, such as going to the gym, you have to keep it up at least a few times a week for a few months in order to see progress. In this video, I have given you a brief overview of what social anxiety is, how common it is, and what treatments are available. I hope you found this information useful and interesting. Thank you for watching this video, and remember, you're not alone. There's hope for overcoming your social anxiety.